Have you ever caught yourself thinking, maybe I'm just tired, maybe this is just aging? But deep down, something feels off. As we age, our bodies change. That's no surprise. But when our hearts feel heavy, when joy fades, and when our days feel gray even in sunshine, that might not be just getting older. That might be something more, something real, something common. It's called depression, and it's not a weakness or failure. It's something many strong, loving, capable adults over 50 quietly face and overcome. Today, I want to gently walk you through what depression actually is, especially for people in their 50s, 60s, 70s, and beyond. This isn't about labels or scare tactics. It's about understanding, clarity, and hope. Because once you see depression for what it is, you can start to heal. Stay with me. By the end of this video, you'll know exactly what signs to look for, what's normal, what's not, and what you can do next. If this sounds like something you or someone you love needs to hear, go ahead and subscribe. I promise to keep bringing you things that matter. Leave a comment with your thoughts or experiences. Your story might be the encouragement someone else needs to take their first step toward healing. Number 1, depression isn't just sadness. It's deeper than that. Depression isn't just sadness. It's deeper than that. Many adults over 50 assume depression means tears or constant crying, but research shows that it often manifests as emptiness, weariness, or feeling stuck in slow motion. A study published by the American Psychological Association indicates that older adults frequently describe depression as a pervasive sense of emptiness rather than overt sadness. Instead of tears, there may be a persistent fatigue that sleep does not erase, leaving daily tasks feeling overwhelming. This mental heaviness often hides behind polite smiles or withdrawal. Some doctors warn that these subtler symptoms can be mistaken for normal aging. When days feel colorless and joy in favorite activities fades, it may not be simply getting older. Many studies suggest that depressed seniors often experience slowed thinking or a sense of mental fog, which can feel like fading from the inside out. Physical complaints such as aches, digestive issues, or headaches sometimes dominate, masking the emotional core. This can lead to delayed diagnosis, since many patients visit their primary care physician for physical pain before discussing mood. Clinical guidelines emphasize paying attention to emotional and physical cues together. Feelings of helplessness or lack of motivation may accompany exhaustion, yet the person may not label these sensations as depression. It can feel like a heavy blanket, making movement and thought laborious. Without clear sadness, friends and family might encourage more activity or dismiss the concerns as normal midlife shifts. Truly recognizing this depth is the first step toward seeking help. Health professionals recommend screening for depression when older patients report unexplained fatigue, withdrawal from social activities, or a general sense of emptiness. Early intervention via counseling, lifestyle changes, or medication can improve quality of life. So why do so many people over 50 miss the signs? That's next. Number 2, the sneaky signs of depression in adults over 50. The sneaky signs of depression in adults over 50 often hide behind what seems like normal aging. Fatigue that never fully lifts, confusion or forgetfulness, and irritability can all signal depression rather than just growing older. A review in the Journal of Geriatric Psychiatry warns that many older patients report persistent tiredness and cognitive slowing that doctors sometimes attribute to menopause, hypertension, or arthritis. Instead of visibly sad mood, older adults may shrug off these feelings as part of the aging process, not realizing depression can masquerade as everyday challenges. Physical aches, headaches, or digestive troubles may dominate the conversation, with primary care physicians who might treat those symptoms without addressing the emotional root. Research in the American Journal of Medicine indicates that nearly half of older patients with depression first present with somatic complaints. Because these doctors focus on prescription pads for pain relief or digestive health, the underlying depression can go unrecognized. Additionally, older adults may hesitate to discuss feelings of hopelessness, worrying it might be dismissed as a normal reaction to retirement or loss. Social withdrawal is another subtle indicator. When invitations to favorite pastimes are declined more often, Family and friends may mistake the decline for simple preference changes. Yet studies show that isolated seniors are at a much higher risk of serious depression. Irritability or restless anger can emerge when frustration builds over unaddressed emotional pain. Such behavior may drive loved ones to label them as grumpy, missing the deeper cause beneath the irritation and mood shifts. Medical guidelines recommend screening for depression during routine visits when these symptoms appear without clear medical explanations. By asking simple questions about mood, energy level, and interest in activities, caregivers and doctors can uncover depression hidden beneath the surface. Early recognition leads to proper care and renewed zest for truly meaningful everyday experiences. You might be treating the wrong problem and missing the real one. Number 3. The difference between grief, low mood, and clinical depression. Grief is a natural response to loss, and when it follows the death of a spouse, the sale of a long-time family home, or a major change in routine, it can feel overwhelming. Grief often arrives in waves, moments of intense sorrow interspersed with relief or acceptance. Low mood, however, might linger for weeks without a clear trigger, leaving a seat-out gentle ache or heaviness that colors each day. Clinical depression goes deeper still, lasting for 2 weeks or more, and accompanied by feelings of worthlessness, loss of interest, and disturbed sleep. Studies indicate that nearly 1 in 4 older adults will experience a prolonged bereavement, and some develop complications that closely resemble clinical depression. Medical experts advise that if the pain of loss remains constant and interferes with routine tasks, such as getting dressed, maintaining personal care, or enjoying social activities, a further evaluation is necessary. Grief generally decreases as memories mature, and support from friends or community offers solace. Low mood may result from ongoing stressors like financial worries or relationship changes, but it often lifts with time or counseling. Screening tools such as the Geriatric Depression Scale help healthcare professionals distinguish these experiences. By asking targeted questions about duration, intensity, and physical symptoms, many family members also notice these subtle differences. Research in the American Journal of Geriatric Psychiatry suggests that early detection and treatment significantly improve outcomes in older adults. Treatment may include counseling, medication, lifestyle adjustments, or a combination of these approaches. Understanding these differences empowers anyone over 50 to take action, such as reaching out for support from loved ones or scheduling an appointment with a mental health professional. This understanding can finally ease fear, renew hope, and motivate steps towards support and well-being. One stays, one heals, and one needs help. Let's break them down. Number 4. How depression feels different. After 50, depression in older adults often does not present in dramatic emotional outbursts. Instead, it appears as withdrawal, apathy, and persistent exhaustion that rest cannot erase. Rather than tears, many adults over 50 describe their experience as feeling empty or mentally slowed. Medical literature explains that age-related hormonal shifts, chronic health conditions, and medications can alter brain chemistry, making depressive symptoms more subtle. For instance, difficulties with concentration, decision-making, or memory might emerge before any obvious sadness. Routine activities, balancing a checkbook, cooking a favorite meal, or driving to a social event, can suddenly seem overwhelming. A study in the Journal of Clinical Psychology found that older patients often report physical complaints such as muscle aches, headaches, or digestive issues, while the emotional component remains hidden. These somatic symptoms can distract from underlying depression. Doctors emphasize asking about sleep patterns, appetite changes, and interest in hobbies to screen for depression even when mood appears normal. Social isolation can intensify these feelings. Retirement, loss of friends, or children moving away create fewer occasions for social interaction. Over time, this reduced engagement can make someone feel disconnected or purposeless, worsening depressive symptoms. When healthcare providers ask patients about their quality of life, some older adults underreport sadness, fearing stigma or believing low mood is simply part of aging. Recognizing how depression feels in this age group is critical. Awareness that fatigue, irritability, and loss of enjoyment often signal a deeper issue helps family members and clinicians intervene sooner. Screening tools tailored for seniors, such as the Geriatric Depression Scale, provide guidance on identifying these subtler signs. Loved ones should note changes in energy or mood lasting weeks, since early recognition opens doors to treatment that restores vitality. And here's where memory and mood start to collide. Number 5. Can depression look like dementia? Yes, and here's why. Depression can affect memory, focus, and decision-making, making it easy to confuse with early cognitive decline, especially when loved ones notice changes. For adults over 50, brain changes related to mood disorders frequently mimic symptoms usually attributed to dementia. A study in the American Journal of Geriatric Psychiatry found that nearly 1/3 of older adults with depression exhibit measurable cognitive impairment. When tasks such as managing finances, remembering appointments, or recalling recent conversations become challenging, it may be caused by depression rather than dementia. Depressed seniors often experience slowed thinking alongside difficulties with attention, processing speed, and independence in routine tasks. Neurological research indicates that prolonged stress in untreated depression can truly shrink the hippocampus, the brain's memory center. By contrast, dementia-related memory loss progresses steadily and is accompanied by persistent disorientation and personality changes. When memory lapses appear alongside low mood, loss of interest, or fatigue, depression is more likely than dementia. Medical guidelines often recommend comprehensive evaluations that include mood assessments, detailed cognitive screening, and review of medical history to determine the cause. Family members and caregivers should note whether forgetfulness correlates with periods of sadness, sleep disturbance, or social withdrawal. Misdiagnosis delays effective treatment, and for depression, proper care can restore both mood and mental clarity through therapy, medication, or lifestyle adjustments. Early detection often leads to significant improvement in cognition, truly renewed energy, and a greater sense of well-being. So before you panic, get the facts. The next part could ease your mind. Number 6. How hormones, sleep, and health changes trigger depression. Changing hormones in midlife can often create imbalances that affect mood and trigger depression. 4. Example. During menopause, fluctuations in estrogen and progesterone influence neurotransmitters such as serotonin and dopamine. Some doctors warn that when these chemical messengers become unstable, older adults may experience mood swings or irritability. Even men face hormonal shifts. Declining testosterone levels can contribute to fatigue, low libido, and a sense of loss that may evolve into depressive symptoms. Studies in the Journal of Affective Disorders show that both men and women over 50 have higher rates of depression when hormone levels decline or fluctuate. Sleep quality also often changes with age, and poor sleep is closely linked to depression. Insomnia, sleep apnea, or restless leg syndrome often emerge in later decades. Research published in Sleep Medicine Reviews indicates that interrupted sleep disrupts the body's ability to regulate stress hormones like cortisol. As cortisol levels remain elevated, it can become harder to fall asleep, creating a vicious cycle of sleepless nights and low mood. When energy reserves dwindle after a night of poor rest, daily functioning becomes more difficult, making it easier to fall into a depressive state. Chronic health conditions such as arthritis, diabetes, or cardiovascular disease frequently accompany aging and increase the risk of depression. Doctors note that living with persistent pain or disability can erode motivation and hope over time. Some medications for these conditions have side effects that impact mood. For example, corticosteroids or beta blockers sometimes contribute to emotional blunting or anxiety. Recognizing these links between physical health and mental well-being is crucial. Understanding that hormones, sleep disruptions, and health changes contribute to depression, caregivers can take proactive steps, like discussing treatment options or sleep hygiene with a physician to address root causes. And guess what? Some of it isn't mental at all. Number 7. Why depression isn't a weakness or character flaw. Depression isn't a weakness or character flaw. Medical professionals classify depression as a brain disorder, influenced by genetics, neurochemistry, and life events, rather than a sign of personal failure. Research from the National Institute of Mental Health shows that fluctuations in neurotransmitters, such as serotonin and dopamine, can trigger depressive symptoms. Adults over 50 often face chronic stresses, managing multiple health conditions, coping with financial instability, and undergoing significant lifestyle changes that gradually impact brain chemistry over time. These biological factors make depression a medical condition that can be diagnosed and treated, rather than something to tough out. Many older adults grew up when admitting emotional struggles was seen as a sign of weakness, reinforcing the belief that distress must be handled in private. Studies published in the Journal of Clinical Psychiatry emphasize that early detection and intervention significantly improve outcomes for late-life depression. Physicians advise considering depression as a treatable medical condition similar to hypertension or arthritis. Cognitive behavioral therapy, medication, and support groups have all proven effective in restoring hope and daily functioning. Careful evaluation often includes simple screening questions about mood, energy, and interest in activities, which can reveal depression even when someone appears physically healthy. Ignoring depressive symptoms out of pride or embarrassment can lead to serious health consequences. Prolonged untreated depression elevates the risk of heart disease, diabetes, and weakened immune response, and it can contribute to social isolation and diminished quality of life. Loved ones and caregivers should offer empathy, listen without judgment, and encourage medical evaluation. Even minor changes, such as a weekly phone call or accompanying a senior to a doctor's appointment, can make a significant difference in breaking isolation. You wouldn't ignore a broken arm. Don't ignore a hurting mind. Number 8. The common triggers of depression. After 50. The common triggers of depression after 50 often revolve around major life transitions and ongoing stresses that accumulate over time. Retirement can suddenly remove a sense of purpose and daily routine, leaving many feeling adrift when weeks stretch without meaningful structure. Loneliness frequently intensifies when friends move away or spouses pass on, reducing social support. Networks that once provided companionship. Caregiving for an aging parent or spouse can bring emotional and physical exhaustion, blurring the line between love and burden. Children moving out and homes growing quieter may amplify feelings of emptiness, as the familiar buzz of family life gives way to echoing silence. Chronic health conditions such as arthritis, heart disease, or diabetes often become more than just medical diagnoses. They become daily reminders of changing abilities and uncertain tomorrows. Financial worries stemming from retirement savings or unexpected medical bills weigh heavily on the mind, sparking anxiety that can spiral into depressive thoughts. Even seemingly small changes, like a favorite hobby becoming too painful to continue or a friend no longer calling as often, erode confidence and sense of self. Social expectations that seniors should be content often silence genuine worries, leaving individuals to suffer in quiet isolation. Research published by the National Council on Aging highlights that when these triggers overlap, loss of role, chronic pain, financial instability, and shrinking social circles, the risk of depression can skyrocket. Understanding that these are not just normal aging, but legitimate emotional challenges is essential. Talking with a trusted doctor or counselor about these specific triggers can uncover hidden depression and lead to targeted support strategies. Each loss, each burden, or each silent moment of worry chips away at resilience. You're not just sensitive, you're human, and your pain matters. Number 9. How to talk to a doctor or loved one about how you're feeling. Many older adults hesitate to share feelings of hopelessness, believing mood struggles are a normal part of aging. Yet doctors emphasize that discussing emotions openly is a critical step toward healing. When scheduling a visit, it helps to write down specific changes in sleep, appetite, or enjoyment of hobbies. During the appointment, self-reporting symptoms, such as persistent exhaustion Lack of interest in social activities or persistent worry encourages accurate assessment. Healthcare providers often start with simple screening questions to gauge mood and energy levels. Clinicians may use tools like the Patient Health Questionnaire, PHQ-9, or Geriatric Depression Scale to identify depression. Studies show that older patients who communicate openly receive faster referrals to mental health services. For those uncomfortable with doctors, confiding in a trusted friend or family member can provide relief and support. Loved ones can help coordinate appointments or accompany someone to visits, offering comfort and helping to explain concerns clearly. Research in the Journal of General Internal Medicine indicates that patients accompanied by family members have higher rates of follow-through on treatment plans. When discussing feelings with loved ones, using specific language, such as "I've been feeling exhausted all day," or "I don't enjoy my favorite activities," helps others understand the severity and encourage professional help. Admitting vulnerability can feel intimidating, but experts agree that honesty is powerful. Reaching out dispels misconceptions and opens doors to counseling, medication, or lifestyle interventions. That first honest word to a doctor could be the turning point. Coming up next, number 10, there is a way out. What recovery looks like. After 50, recovery from depression after age 50 often unfolds gradually rather than overnight. Health professionals note that small shifts, like waking with a slight spark of interest or enjoying a familiar activity for a few minutes, can signal the first glimmers of change. Therapy sessions can provide tools to reframe negative thoughts, while medications guided by a physician may improve mood over weeks. Studies published in the American Journal of Geriatric Psychiatry report that older adults who follow tailored treatment plans often experience significant improvements in energy, sleep, and social engagement within 2 to 3 months. Lifestyle. Adjustments such as gentle exercise routines or improved sleep habits support this process by boosting endorphins and stabilizing circadian rhythms. Nutrition also plays a crucial role. Consuming balanced meals rich in omega-3 fatty acids, whole grains, and colorful vegetables can help regulate neurotransmitters that affect mood. Support groups designed for adults over 50 offer a sense of community and shared understanding that research shows can reduce feelings of isolation. Family involvement and encouragement from friends create a safety net that reinforces progress and accountability. Clinicians emphasize that setbacks may occur, but they often reflect temporary obstacles rather than failure. Trust in the process and professional guidance fosters resilience. With consistent care, many seniors find a renewed sense of purpose, rediscover joy in hobbies, and rebuild social connections. Ultimately, recovery after 50 means truly embracing incremental victories, each positive moment a step toward greater well-being. The road back may be slower, but it's still yours to walk. If this video helped you better understand depression after 50, consider sharing it with someone who might need to hear it too. And if you're ready for the next step, join us in the next video, where we'll talk about natural ways to lift your mood after 50. It's full of simple, science-backed habits that can gently support emotional balance. No pressure, just real, doable things that can make each day feel a little lighter. You're not alone, and every step forward counts. See you there.